This is LFP Billing Tips. I'm Dr. Namrata Jhamb, family physician from Burnaby, BC, and I provide obstetrical care at Royal Columbian Hospital. We are going to talk about the LFP Pregnancy-Related Surgical Assist Code, billed as 98174 for longitudinal family physicians with a patient panel, and 98274 for locums covering for a host physician. In order to bill facility-based pregnancy and newborn care, first, you must be enrolled in the LFP payment model. This means you have submitted 98000 as a longitudinal family physician or 98005 as an LFP locum to MSP in the calendar year. Second, you must have submitted the Pregnancy and Newborn Care Setting Registration Code 98006 to MSP in the calendar year. And third, you must have privileges to provide family medicine obstetrics care in a health authority operated or affiliated hospital. There are three in-hospital scenarios under which you will bill 98174, the Pregnancy-Related Surgical Assist Code. The first is when providing an emergency C-section surgical assist for a patient of another physician or midwife. This means you are not the most responsible physician for the patient. Your role is only to provide the surgical assist. The second is when providing a surgical assist in the hospital for an elective C-section. Note the distinction here between elective C-sections and emergency C-sections. If you are the MRP providing the surgical assist for a patient having an elective C-section, bill the surgical assist code. If you are the MRP providing the surgical assist for a patient having an emergency C-section, bill the LFP birth code. For most deliveries, bill either the surgical assist code or the birth code, but not both. Please see our LFP billing tip on the LFP birth code for more information. The third scenario is when providing a surgical assist for an obstetrical surgery separate from birth. Let's go through a couple of examples of this. Case number 1. 2 days after your 31-year-old patient's C-section, it is noted they have worsening abdominal pain and ongoing dips in their hemoglobin. They return to the OR for a laparoscopy due to a suspected internal bleed, and you provide the surgical assist. You already billed the birth code for the patient's emergency C-section 2 days prior. Can you bill 98174 for the peripartum surgical assist? The answer is yes. Since your patient's obstetrical complications result in a surgery provided separately from birth, the pregnancy-related surgical assist is billable even though you already billed the birth code for the patient previously. Your time spent providing the surgical assist is also payable as the appropriate pregnancy and newborn care direct patient care time. Now let's do another example. Case number 2. Your 39-year-old patient has a spontaneous vaginal delivery that results in a 4th-degree perineal tear. She is taken to the OR for repair of the perineal tear, and you provide the surgical assist. Again, you already billed the birth code for this patient for managing the birth. Can you bill 98174 for the peripartum surgical assist? The answer is yes again. You provided a pregnancy-related surgical assist for an obstetrical complication separate from the birth. Even though you already billed the birth code for managing the patient's labor, in this case, you can still bill 98174 for the pregnancy-related surgical assist. And of course, your time providing this care is also payable. Now let's do one last case. Case number 3. Your 34-year-old patient that was scheduled for an elective C-section in 6 days from now presents to the ER with signs of fetal distress. An emergency C-section is required, and you provide the surgical assist. Would you bill 98174? The answer is no. You would not bill a pregnancy-related surgical assist since you are the physician managing the birth and an emergency C-section is required. Instead, the LFP birth interaction code is payable for the in-person management of the emergency C-section birth, along with direct patient care time. Now you can feel confident when billing the LFP Pregnancy-Related Surgical Assist code. Remember, when you are the physician managing the labor, an elective C-section and an emergency C-section are billed differently. Bill the pregnancy-related surgical assist for the elective C-section and the birth code for the emergency C-section. After having watched this video on the LFP pregnancy-related surgical assist code, make sure you watch the LFP billing tip on the LFP birth code, 98173 or 98273. Other helpful links can be found in the description. If you found this video useful, click the subscribe button below to see more LFP billing tips.